Hello, my name is Dr. Ron Olsen, and in this video I will be providing a short introductory summary highlighting the use of carrier beads as a local drug delivery system. While this is an area of active research and more extensive discussion of these topics and their research is available, this video is meant to be an overview, focusing on a few scientific papers which support the clinical use of carrier beads in a veterinary setting and helping you get your start if you've never used carrier beads before. Firstly, we'll be discussing the efficacy of antibiotic-impregnated materials, particularly calcium sulfate beads. We'll discuss several scientific papers from both human and veterinary medicine, which highlight their benefits and safety. Next, we'll be talking about the way that these beads are primarily applied in the treatment and prevention of soft tissue and orthopedic infections. We'll also touch on how they are used as local extravascular delivery systems for chemotherapeutic agents. And then to finish the video, I'll share my thoughts and experience with regards to dosing medications when they are applied in this way. To begin, we need to highlight the challenge that we face with traditional systemic administration of medications, particularly antimicrobials. When administering medications systemically, our dosing is limited by the safely achievable serum levels of those medications. If those safely achievable serum levels are exceeded, the patient is at an increased risk of developing negative side effects and toxicity. Additionally, as observed by Fremau in Seminars for Plastic Surgery 2009, culture and susceptibility interpretations are based on achievable serum levels, and these may differ significantly from the levels that are achievable in bone and surrounding tissue. For example, healthy bone specimens removed at surgery showed levels of cefazolin and other cephalosporins ranging from 10 to 20% that of the serum levels. And serum levels may be even lower in diseased tissues with poor vascular perfusion. So, when giving these medications for the treatment of a localized disease, such as post-traumatic osteomyelitis, which is pictured here to the right, we are limited in how much we can give safely, and yet the amount of drug that actually reaches the site of interest may be even lower than serum levels. Factors that can affect delivery include the inherent density of the blood supply to the affected tissue, any local ischemia in that area due to trauma or necrosis of tissues, and the presence of implants which have no blood supply to them. Whether such implants are metal or even suture, bacteria may be able to colonize those materials and enjoy the inherent protection that comes from a lack of perfusion and the inability of leukocytes or antibiotics from being able to reach them effectively. This problem is further compounded by the inherent and acquired antimicrobial resistance factors which planktonic bacteria may possess, and bacteria that are able to form biofilms, particularly on implants, enjoy a significantly higher level of protection from those leukocytes or antibiotics. Local administration of medications to these sites using antimicrobial impregnated materials, or AIMs, has demonstrated in many studies across both the human and veterinary literature to provide a potent counter to these challenges, and has shown superior efficacy in the treatment of focal disease compared to systemic administration. When AIMs are implanted at a surgical site, they demonstrate an initial elution concentration that may reach levels of 500 to over 1,000 times the safely achievable serum concentrations that can be obtained through systemic administration of the same medication. At the same time, these elevated local concentrations are not seen systemically, as concurrent systemic concentrations remain very low or not even detectable. This minimizes any risk for toxicity or negative side effects. This was effectively demonstrated in a paper by Nelson et al. In 2002, in which tobramycin-impregnated calcium sulfate beads were implanted into experimentally induced cases of osteomyelitis in rabbits. Tobramycin concentrations reached a peak shortly after implantation of 11.9 milligrams per milliliter in wound exudates, while concurrent serum concentrations from bead implantation only reached 5.87 micrograms per milliliter, and that was 3 hours post-implantation. By the next day, tobramycin was not detectable systemically. Separately, the investigators found that with intravenous administration of tobramycin, they were only able to reach a maximum serum concentration of 7.82 micrograms per milliliter. It should be noted here as well that while the most common application of this drug delivery method is its use for the treatment and prevention of orthopedic or soft tissue infections, these same principles of efficacy have been seen with local administration of chemotherapeutics, which will be discussed later. While there are many materials which have been used as carriers for local antibiotic delivery in clinical and research settings, calcium sulfate beads are the most common and cost-effective method currently seeing clinical use. And carrier beads are currently the only commercially available calcium sulfate bead kit marketed specifically for veterinary use. Elution of antibiotics from calcium sulfate beads has been studied extensively, and while the rate of elution can vary depending on the medications used, they tend to demonstrate a rapid initial elution of most of the antibiotic load, followed by a sustained elution at lower concentrations long term. One study by Sanchi in 2003 found that gentamicin beads released 80% of the contained gentamicin within 48 hours of implantation. In vivo, these supratherapeutic local concentrations are then generally maintained for up to 14 days. When the antibiotic is eluted locally at such extremely supratherapeutic concentrations, mechanisms of antimicrobial resistance can be overwhelmed, and bacterial cultures which may have demonstrated resistance with traditional susceptibility testing may actually become highly susceptible to the antibiotic administered. Additionally, several studies, including Moley et al. In 2018, have demonstrated that antibiotic-impregnated materials may even have antibiofilm potential due to these extremely high local concentrations. Another advantage of calcium sulfate beads is that they are bioabsorbable and tend to fully resorb within about 8 weeks of implantation, as demonstrated in the radiographs on the right. This means that the beads themselves do not become a foreign body within the tissues, and it means that all of the antibiotic contained within the beads will be utilized. This slide serves to further reinforce the point that I made on the previous slide, that through the use of local antibiotic delivery systems, we can combat the rise in antimicrobial resistance. This is because exposing the bacteria to extreme supratherapeutic local concentrations of the medication presents to them a more powerful bactericidal effect. It overwhelms the planktonic antimicrobial resistance mechanisms, as well as diffuses through biofilms at concentrations which are effective against the bacteria contained within them. At the same time, the medication remains concentrated predominantly at the area of interest only. This comes in contrast to traditional systemic administration of antibiotics, in which lower concentrations of the medication spread across the entire body of the patient. These lower concentrations may select for more resistant bacteria at the site of infection, and systemic distribution of the medication may result in gastrointestinal and skin flora also being affected. In terms of safety, because antibiotic administration with Kerrier beads maintains a high concentration of the drug at the site of interest, with minimal systemic distribution of the medication, there seems to be low risk for adverse effects when using this method. This is well illustrated in a paper by Turner et al. In 2005, in which tobramycin beads were implanted in dogs at an approximate total dose of 36 milligrams per kilogram. For tobramycin, the total daily recommended dose in dogs should not exceed 14 milligrams per kilogram. Despite that recommendation, no adverse effects from high levels of aminoglycoside administration were observed in any of the dogs receiving tobramycin beads. This suggests a wider margin of safety when administering antibiotics with this method. In the literature and my personal experience, calcium sulfate beads are generally well tolerated and associated with few adverse events. Anecdotally, myself and others that I've spoken with have observed some increase in fluid production from the surgical site when these beads are implanted. This tends to resolve without intervention and seems to have minimal clinical significance. There have also been occasional reports of transient hypercalcemia, such as the case reported by Epstein and Venegas Acosta in 2022. This is presumably due to the release of calcium as the beads dissolve and did not result in any clinical problems. Clinical signs from excessive elution of an antibiotic, effectively overdosing the patient, are occasionally reported with antibiotic-impregnated materials in general. Chowdhury et al. In 2023 reported cases of nephrotoxicity from antibiotic-laden cement spacers used in human joint replacement. So, it is theoretically possible that this could be seen with excessive implantation of Kerrier beads. However, to date, I have not been able to find any reports of this actually occurring. Kerrier beads have been used successfully in a wide range of clinical applications for both small and large animals. Mostly, they see use in the treatment of localized soft tissue and orthopedic infections. Examples of these are pictured to the right. On the top is a series of pictures taken for a case of osteomyelitis that developed following a tibial plateau leveling osteotomy. After medically managing the infection until the bone was sufficiently healed to allow implant removal, I removed the bone plate and implanted Kerrier beads throughout the surgical site where the plate had been. In the radiograph on the bottom left, I implanted beads around the site of an open femoral fracture, which was greater than 48 hours old by the time the surgery was performed. The radiographs on the bottom right are not mine, but come from a case reported by Guthrie and Fitzpatrick in 2019, in which calcium sulfate beads were used in a case of successful single-stage explantation and revision of infected total hip replacement prostheses. Application of beads in this manner should always be done in conjunction with traditional management of infected wounds. This includes debridement of necrotic tissues within the wound, removal of implants whenever possible, thorough lavage of the site, and collection of samples for culture and susceptibility testing. Systemic antimicrobial administration should also be initiated either empirically or based on sensitivity results. I have found that using Kerrier beads in this way often allows me to shorten the course of systemic antibiotic administration, especially when the results suggest that the antibiotic contained within the beads is effective against the target bacteria. Kerrier beads may also be applied prophylactically. The prevention of potential infections has a special appeal in cases where implants will be utilized. It's critical to emphasize here that Kerrier beads are adjunctive to strict aseptic technique in these cases and should not be relied on as an excuse not to uphold high surgical standards. A prospective study by De La Chica et al. In 2022 reported that the use of antibiotic-impregnated calcium sulfate beads decreased the incidence of periprosthetic joint infections in cases of human total hip replacement and total knee replacement. While this application is beneficial in all cases where implants may be used, like with the TPLO pictured on the right, it may be especially valuable in joint replacement cases where the success of the surgery is largely dependent on the implant's ability to remain in place throughout the patient's lifetime. One concern that has arisen with the use of calcium sulfate beads near dynamic implants is whether the presence of the beads or their dissolving particulates may cause excessive wear on the articulating surfaces of these prostheses. But an in vitro study by Huberger et al. In 2014 found that this was not the case. As previously mentioned, aside from the delivery of antimicrobials through calcium sulfate carriers, these beads have also seen increasing use for local extravascular delivery of chemotherapeutic medications, particularly medications like carboplatin or cisplatin. Following surgical excision of a mass, these beads are implanted in the wound bed at the surgical site and have been used along with systemically administered chemotherapeutics or as an alternative primary chemotherapeutic delivery method. These chemotherapeutic impregnated beads demonstrate similar elution characteristics as discussed with antimicrobials, as was reported by Traverson, Stewart, and Papich in 2022. And have been used following excision of various tumors, including soft tissue sarcomas, mast cell tumors, nasolacrimal adenocarcinomas, and sarcoids. An extensive review article by Risalata and Worth in 2023 summarizes much of the recent literature on the subject, reporting effective use of the beads in both large and small animals, and they report that across many studies, adverse effects associated with local chemotherapeutic administration are uncommon and are typically minor and self-limiting. One of the most common questions I receive from clinicians that are new to using Kerrier beads is how many beads should be used for a particular patient. It's important to recognize that administration of antibiotics or chemotherapeutics in this manner is off-label, and there are currently no established standards in human or veterinary medicine to guide dosing decisions. This means that the question of dosing is left to the good judgment of the primary doctor on the case. Now, while this lack of published guidance may not be very encouraging, many clinicians that use the beads routinely tend to use the guideline of implanting enough beads so that the amount of total drug delivered is equal to the maximum recommended daily systemic dose of that drug. This tends to deliver plenty of medication to the site of interest to be effective and reduces the risk of negative side effects. Even if all of the medication contained within the beads was released at once, it should not be a sufficient amount to cause toxicity to the patient. I have personally found this to be a pretty good guideline when making decisions. However, I do want to reiterate that Turner paper that I mentioned previously. In that paper, there were no adverse effects when administering tobramycin to dogs at approximately 2.5 times the recommended daily dose. This knowledge helps me feel comfortable implanting more beads if I deem it necessary and have the room within the surgical site to do so. To help illustrate this point and show from my personal experience what I might do in a clinical case, I have here a hypothetical 25 kilogram dog undergoing open reduction and internal fixation for a humeral fracture. When I use Kerrier beads, most commonly I use 1,000 milligrams of amikacin per Kerrier kit to make 5 millimeter beads. There are 113 wells for 5 millimeter beads in the Kerrier kit mold mat. This means that there should be approximately 8.85 milligrams of amikacin per bead. For dogs, common formularies recommend a maximum daily dosage of 30 milligrams per kilogram of amikacin. For a 25 kilogram dog, this means 750 milligrams total. If I divide the total dose by the amount of amikacin contained within each 5 millimeter bead, I find that I need to implant approximately 85 beads to deliver 750 milligrams of amikacin. It would be perfectly acceptable to count out 85 beads and implant them into the surgical site. However, based on the literature that I've cited, I would feel comfortable rounding up a little bit and adding a few more beads. In reality, for this case, I would probably just use all of the beads that I have, delivering a total amikacin dose of 1,000 milligrams, which ends up being about 40 milligrams per kilogram in total. I hope this video has been helpful. If you have any questions regarding these topics, feel free to reach out to me using the email listed here. For more information regarding Kerrier beads, their efficacy, safety, or applications, or to place an order, visit Kerrier.com. Thanks for watching.